Vaginal and vulvar cancers are actually very low yield on the test, and really for life because they're kind of rare. But I'm going to tell you about them to round out the total conversation about cancers in OBGYN. What I'm going to tell you is only the essential details you need to know to get the questions right. First, let's talk about vulvar cancer. And there are three types: squamous cell carcinoma, melanoma, and Paget's disease. Squamous cell carcinoma and melanoma are essentially the same disease and totally indistinguishable except by biopsy. They both present as black lesions that itch. The lesions are black and itchy. On the USMLE step questions, Paget's disease is the only thing that's going to be a red lesion, and this is the huge tip-off, and it is also usually itchy. The diagnosis is of course going to be made by a biopsy, so they're probably not going to ask that question. What they'll probably ask you is, what is the appropriate treatment? Squamous cell carcinoma and melanoma are invasive skin cancers that can kill you. So you're going to do a vulvectomy. Remove the source of skin cancer. This can cause sexual dysfunction, and do a lymph node dissection to make sure it hasn't metastasized. Paget's disease, on the other hand, unlike Paget disease of the breast, is actually very benign, and so a simple local resection is curative. And so as sort of as a review, squamous cell carcinoma, dark lesion, can invade. Melanoma, dark lesion, can invade. Paget's disease, red lesion on the surface, does not invade. All of them are itchy, all of them are diagnosed by biopsy, but Paget's disease is different because it responds to local resection. And watch how easy this is and why it's such a low yield topic. If someone comes in complaining of pruritus, the most common cause of an itchy vagina is an infection. And so of course you're going to take a look. You do a speculum exam, and before you do that, you inspect the vulva. If you see nothing, chances are it's an infection and it's not a cancer. If you see something, you're going to get a biopsy. And from that biopsy, we'll tell you squamous cell carcinoma, melanoma, or Paget's. And as we just learned, squamous cell carcinoma, melanoma, you're going to do a vulvectomy, which can lead to sexual dysfunction, and lymph node dissection. And Paget's disease, you can use a local resection. And I'm going to finish off with a disease that has even fewer details, vaginal cancer. Vaginal cancer comes in two forms: squamous cell carcinoma and adenocarcinoma. Everything you know about cervical cancer is true of vaginal cancer. Squamous cell carcinoma is caused by HPV. Anywhere semen can go, HPV can go. Anywhere semen goes that has an epithelium can cause squamous cell carcinoma. Squamous cell carcinoma of the anus, squamous cell carcinoma of the esophagus, squamous cell carcinoma of the vagina or of the cervix. Everything you know about cervical cancer is true of vaginal cancer, squamous cell carcinoma, except that you don't do a PAP on the vaginal wall. The one you should pay the most attention about for the shelf or for the step is adenocarcinoma, because it's caused by DES exposure. You are never going to see a patient with adenocarcinoma in the clinic because DES hasn't been used in 50 years. If you see a grape-like structure in the vagina, don't be confused with choriocarcinoma, which is also a grape-like structure when you surgically operate. If you see a grape-like structure in the vagina, it's probably adenocarcinoma. And what you should look for is whether or not the patient in front of you right now, while she was in mom's uterus, did mom get DES? That is, the patient's mother had to be pregnant with your current patient and received DES while she was pregnant for your current patient to get adenocarcinoma. It's a great board association question, but it's nothing you're not going to see in real life. If adenocarcinoma, look for DES exposure. Both of these are very low yield cancers, and you don't have to spend very much time learning them. They're just included to round out our discussion of OBGYN cancers and then to prepare you for the step and for the shelf. That is vulvar cancer. We make these videos for free, and we need your help. Please donate, because without your donations, we can't make any more videos. Please donate.